Hey everyone, and welcome to the Deep Dive. Today we're diving deep into Moyamoya disease and syndrome. It's a topic that may not be super familiar to every listener, but it's definitely essential for healthcare providers and those of you in residency.
Absolutely. We're going to be talking about a condition that has direct implications for how we manage patients. So let's get right to it.
Okay, sounds good. So to get us all on the same page, let's start with the basics. Moyamoya, what is it exactly? We're talking about those crucial arteries that supply blood to the brain, the ones that surround the circle of Willis, right?
Exactly. And what happens is they start to narrow and get blocked. And that's where things get really interesting. You know, imagine the brain needing this constant flow of blood, kind of like a busy city that needs supplies. Suddenly, the main highways are blocked off.
Oh, wow, I see what you mean.
Yeah.
A total traffic nightmare for the brain.
Yeah.
So how does the brain even cope with that?
Well, it tries to compensate. It starts growing these tiny, fragile blood vessels. Think of it like creating back roads and detours, trying to handle the massive load that was meant for a highway.
Wow, that's an incredible way to visualize it. And those detours, they're definitely not built for that kind of traffic, right? That's where the risk of stroke comes into play, both ischemic and hemorrhagic.
Precisely. And what's really fascinating is that we're learning that Moyamoya isn't as geographically restricted as we once believed. It's not just an East Asian disease anymore.
You're right, the research is really challenging those old assumptions. The AHA statement from 2023, the one published in Stroke, highlighted how Moyamoya is being diagnosed more frequently in the US, especially in white women. That wasn't what we traditionally expected, was it?
Not at all. This definitely underscores the need for vigilance in all patient populations. And here's another really important point from that same statement. The annual risk of stroke. Even in patients without any symptoms, it sits around 5%.
Wow, 5%. That's actually a significant risk. So it's not just about recognizing the classic stroke symptoms. We really need to be thinking about risk factors and early detection. Now, what about the genetics behind Moyamoya? Does everyone with this condition have a family history?
Not necessarily. There's definitely a genetic component. The RNF213 gene is a major player, but it's not always a straightforward situation.
So it's not as simple as you have the gene, you have the disease.
Exactly. This is where the concept of incomplete penetrance comes in. Imagine having a loaded gun. Just because it's loaded doesn't mean it'll fire every time you pull the trigger.
Okay, that makes sense. So even if someone tests positive for the RNF213 gene, they might not actually develop Moyamoya. So how do we use genetic testing in our clinical practice then?
It's a tool, not a crystal ball, right? It helps
Right.
us assess risk. But it's not a standalone diagnostic by any means. And what's really intriguing is that recent research, some of which was highlighted in that Cerebrovascular Diseases Extra Review from 2024, suggests that this RNF213 gene may also play a role in the immune system. It may even act as an antimicrobial protein.
Wow, so there could be this complex interplay between genetics, the immune system, and environmental triggers. This is where things get really exciting. But for now, let's bring it back to the clinical setting. How do we actually diagnose Moyamoya in our patients? What signs and symptoms should we be looking out for?
Well, of course, we have the classic presentations, ischemic and hemorrhagic strokes. But Moyamoya can be a bit sneaky sometimes.
You mean it can present as other things?
Absolutely. Think about cognitive issues, memory problems, difficulty concentrating, even persistent headaches.
Okay, so a pretty wide range of presentations. What's our go-to method for diagnosing Moyamoya?
Digital subtraction angiography. That's the gold standard. It gives us a very detailed roadmap of the blood vessels in the brain.
Ah, so that's how we see those puff of smoke vessels in action. But we don't just stop at angiography, right?
Right. We also utilize advanced imaging techniques like MRI and MRA. These help us assess blood flow and pinpoint areas that might be at risk. It's like getting a traffic report for the brain.
Makes perfect sense. Get a complete picture of what's happening. Okay, so let's say we've diagnosed a patient with Moyamoya. Now the big question is, how do we manage it?
That's where things get really interesting and potentially a little bit controversial. Let's start with medical management, specifically the role of antiplatelet therapy.
Antiplatelet therapy. So we're talking about things like aspirin, right? That seems pretty standard for preventing strokes.
It does. But with Moyamoya, there's a bit of debate surrounding its use. Asian experts and Western experts don't always see eye to eye on this one.
Interesting. So what do the current guidelines recommend?
The 2021 AHA-HASA guideline, published in Stroke, suggests that aspirin may be reasonable for patients who've already experienced a stroke or a TIA to help prevent another one. But it's not a blanket recommendation for all Moyamoya patients.
So it's more of a judgment call based on individual patient factors. Now, I noticed that in that review from Cerebrovascular Diseases Extra, cilostazol was mentioned quite a bit. What's the story with that medication?
Cilostazol is an interesting one. It's an antiplatelet medication, but it also has the ability to widen those blood vessels. Think of it like clearing the traffic jam A and D, expanding the roads at the same time.
That sounds pretty promising. What does the research say about its effectiveness?
The studies are still relatively small, but they do suggest that cilostazol might improve survival rates, boost blood flow to the brain, and even have positive effects on cognitive function. We definitely need more data to confirm these findings, but it's certainly a medication to keep an eye on.
Okay, I'll keep that in mind. Now let's talk about those headaches that patients with Moyamoya often experience. Can we just treat them like regular migraines?
That's actually a common mistake. Medications that we typically use for migraines, like triptans and beta blockers, can actually worsen the situation in Moyamoya patients.
Oh, really? Why is that?
Because they can constrict blood vessels. And that's the last thing we want in a brain that's already struggling to get enough blood flow.
Right, that makes sense. So those medications are a big no-no. Got it. Now, let's move on to surgical management. What does our surgical toolbox look like for Moyamoya?
When it comes to surgery for Moyamoya, we're primarily talking about revascularization procedures, essentially creating bypasses to redirect blood flow around those narrowed arteries.
Kind of like building a whole new highway to bypass that traffic jam we talked about earlier. What surgical options do we have?
We have direct bypasses, where we directly connect an artery from outside the skull to an artery inside the brain. It's like creating an instant detour. And then we have indirect bypasses, where we place tissues, like a piece of muscle, onto the brain's surface. This encourages the growth of new blood vessels.
So a more gradual approach with the indirect bypass. Which type of bypass is considered better?
That's the million-dollar question. The only randomized controlled trial we have so far for Moyamoya is the one from Japan. It focused on hemorrhagic cases and found that direct bypass surgery significantly reduced the risk of another bleed, which is a huge finding.
Okay, so there's clear evidence supporting surgery for hemorrhagic Moyamoya. But what about the ischemic type? What does the research tell us about that?
Unfortunately, we don't have the same level of evidence for ischemic Moyamoya. Most of the research is retrospective or non-randomized.
So it's a bit of a gray area in terms of definitive recommendations. But overall, the research seems to suggest that surgery can be beneficial for both types, right?
That's right. Meta-analyses have indicated that surgery is helpful for both hemorrhagic and ischemic Moyamoya. And the 2021 AASA guideline gives it a Class 2A recommendation.
So it's definitely a treatment option worth considering. Now, for our anesthesiologists and perioperative teen listeners out there, are there any specific considerations we need to keep in mind for Moyamoya surgery?
Absolutely. Maintaining hemodynamic stability throughout the entire procedure is paramount. We want to keep the brain's blood flow nice and steady, like a well-tuned engine. No sudden surges or drops in blood pressure.
Okay, so steady as she goes. Now, I've heard about a complication called cerebral hyperperfusion syndrome, or CHS. Can you explain what that is exactly?
CHS basically occurs when there's excessive blood flow to the brain after surgery. Those fragile Moyamoya vessels just can't handle the sudden rush of blood, and it can lead to problems like brain swelling or even bleeding.
So it's like the detour is suddenly getting slammed with traffic. Definitely not a good situation. How common is CHS and who is most at risk?
Studies suggest that it occurs in about 11–22% of cases, and it's more frequent in adults than in children. Some of the risk factors include older age, pre-existing issues with blood flow before surgery, operating on the dominant side of the brain, and longer periods of clamping off blood flow during the operation.
Okay, so we need to be extra cautious with those patients. How do we treat CHS if it does occur?
Quick recognition is key, and we aggressively manage blood pressure to reduce that excessive flow. It's like easing the pressure on that overwhelmed detour.
Makes sense. Now, before we wrap up, I have to ask about stents and angioplasty. Why can't we just use those procedures to open up the narrowed arteries in Moyamoya?
That's a logical question, but unfortunately, those endovascular treatments haven't proven to be very effective for ischemic Moyamoya.
Really? Why not? It seems like a pretty straightforward solution.
The issue is that the narrowing in Moyamoya isn't like a simple blockage. The entire vessel wall is affected. It's almost like the artery is collapsing in on itself. Stents have a hard time staying open in those conditions, and angioplasty doesn't provide long-lasting results.
So it's a much more complex problem than just opening up a clogged pipe.
Exactly. Plus, there's a real risk of making things worse with those procedures, like causing a tear in the vessel or even triggering a bleed.
Okay, so those treatments are not a good option in this case. What about for the aneurysms that are sometimes associated with Moyamoya? Can we use stents or coils to treat those?
No, that's a different story. Endovascular techniques can be very effective for treating aneurysms in Moyamoya patients. We can use coils or other embolic agents to seal them off and prevent them from rupturing.
So there's a specific role for endovascular treatment in that scenario. Great. We've covered a lot of ground today, lots for everyone to think about. What are some of the big unanswered questions in Moyamoya research? What are the frontiers we still need to explore?
Well, there are still many mysteries surrounding Moyamoya.
Right, even with all the progress we've made.
The AHA scientific statement from 2023 really emphasized the need for better diagnostic criteria.
And more reliable biomarkers to accurately identify Moyamoya, I imagine.
Precisely.
Of course, we're also always looking for more definitive treatment guidelines.
Especially for ischemic Moyamoya.
Yeah, more high-quality studies are needed.
Especially randomized controlled trials.
Those would really help us make the best treatment decisions for each patient.
Absolutely.
So it seems like there's still a lot of work to be done when it comes to Moyamoya.
There is, but the good news is that there's some exciting research happening right now.
Oh, that's great.
Things like dynamic global registries.
Those are really helpful, right?
Yes, they help us collect more data.
Which leads to more insights about Moyamoya.
Exactly.
I've also heard about a growing interest in registry-based, randomized clinical trials.
Those are very promising.
More efficient.
And more patient-centered.
Sounds like the future of Moyamoya research is looking pretty bright.
It definitely is, with lots of promising avenues to explore.
Well, I think we've given our listeners a lot to think about today.
I agree. We've covered a lot of ground.
From those less obvious presentations
to the complexities of medical and surgical management.
We've even busted a few myths along the way.
Like the idea that stents and angioplasty can fix everything with ischemic Moyamoya.
It's just not that straightforward, as we've discussed.
Right.
We've also highlighted some really important clinical pearls.
Yes, definitely.
Like avoiding those migraine medications.
The ones that can constrict blood vessels.
So important to remember that.
And of course, the absolute importance of maintaining stable blood flow during surgery.
All about protecting that brain.
Yes, absolutely crucial.
For everyone listening, I want to remind you that this deep dive was based on 2 excellent articles.
Adult Moyamoya Disease and Syndrome, Current Perspectives and Future Directions. A scientific statement from the American Heart Association, American Stroke Association.
Published in Stroke in 2023.
And Antiplatelet Treatment in Moyamoya Disease. A systematic review.
Published in Cerebrovascular Diseases Extra in 2024.
We've included links to those articles.
And some other great resources as well.
In the description below.
So be sure to check those out.
Yes, lots of good information there.
As we wrap up, I want to leave you with this.
Okay.
Given the rising incidence of Moyamoya,
especially here in the U.S.,
how can we as healthcare providers improve early detection?
That's a great question.
And referral for specialized care.
It's crucial.
How can we ensure that our patients get the expert care they need?
Early diagnosis and timely intervention are key.
Thanks for joining us on this deep dive into the world of Moyamoya.
It's been a pleasure.
It's a condition that truly demands our attention.
And our best clinical judgment.
Until next time, stay curious.
And keep learning.
Bye, everyone.